The Well Centre is a young person's health and wellbeing clinic that supports young people aged 13 up until your 21st birthday.
We have GPs here, we have youth workers, and we have a senior mental health nurse. And what we do here is we aim to provide easy access for young people to have any discussions with any of the appropriate team members around anything that's concerning them around their health.
There's a range of ways in which people can get here. They can be referred, they can self-refer, they can be referred by their school, they can be referred by their GPs, or friends who've used the service before might recommend, say, actually, I got a good experience here, I think you should go and see somebody there.
What we know about young people is they don't just have one need, they have lots of needs, and it's best if we can meet as many of those needs as we can in one place.
The type of concerns that young people might come here with are anxiety, depression, self-harm, eating concerns, relationship issues. I can go on.
My role is to support young people with their emotional well-being, give them advice about drugs and alcohol, support them with their sexual health, signpost them to more specialist organisations.
Many young people find it hard to access their own GP, either because it's hard to get an appointment or they have misplaced fears about confidentiality.
The adolescent age group is a very tricky one. They like their lives to be secret and they don't want their parents or the people around them knowing about them having concerns. And so they might choose not to go to their GPs, and that's why Well Centre becomes different, because they can come here confidentially and have their needs assessed.
Where they have a good relationship with their GP, that's ideal, and that should be maintained and it should be supported. But when that doesn't fit, rather than leaving young people with nowhere to go, this model absolutely does seem to fit the bill for those. It's a more informal environment. It's an environment that we created in partnership with young people. They helped us to design the space, they helped decorate the space.
We have music playing, we also have a Wii computer console for young people to play on, and we offer people tea, coffee, hot chocolate, and if they're lucky, toast.
70% of our young people coming through the door have heard of it through word of mouth, and it does seem to suit their needs.
A lot of the educational outreach that we do spreads the words in local schools, so we have lots of young people who live locally who pop in.
Every young person that comes through the door here gets what we call a teen health check. So that entails not just asking about their health, but asking opportunistic questions around other aspects of their life that may impact on their health. So their living circumstances, their educational attainment, whether they're in employment. A young person may come in for sexual health, but in the course of the teen health check, we will find out that actually they have significant mental health issues. They will always get to see the GP the very first time they come in the door, and they also get to see a youth worker. And then depending on their need that is determined in the teen health check, we then either continue to support them with the GP or might refer to the mental health nurse, and the youth worker will remain involved in their care. We signpost young people to appropriate services. For example, NHS Go is an app easily downloadable on their phones, and it has lots of very useful and important information around how to look after themselves and appropriate self-care.
I think there should be more centres like this in London and across the whole of the UK.
I think this is the sort of service that should be replicated everywhere.